This theme is very important. The world is moving into digitalization. With all the different innovations, we need digital health and we need digital types of surveillance so that we are able to have real-time surveillance for real-time response. For CAFA, this is important because we are small, we are interconnected. All our islands are small and they're interconnected. If you have a disease threat in a particular island, it's likely going to be spreading to other islands. So we need to have digital, innovative systems that can capture a case of illness in real time, so you will have real time response. I would say we are a work in progress and we are getting there. Where we are now, we are much better prepared than pre-COVID. And that is largely that COVID taught us what were some of our gaps and how we can improve that. And since then, CAFA has been, privileged to get a pandemic fund grant, which was, focus on improving surveillance laboratory capacity as well as workforce development and partnerships for pandemic preparedness and response. We got this grant in late 2023, but in the last year and a half, we have been able to develop real-time early warning systems. You are able to digitally know what something is happening and you are able to so that you can respond faster. And that is then supported by advanced laboratory testing. So we have our 3 laboratories, which are in Jamaica, Trinidad, and St. Lucia. They are now equipped with state-of-the-art laboratory equipment that is able to test for a range of priority pathogens within 2 hours. And we have also supported the member states so that, we have 10 member states that have these small bio-rapid test kits and can be able to test, for priority pathogens within 2 hours. On top of that, we have built workforce capacity, for One Health surveillance. So, you needed that all of society type of approach for surveillance. And all of this also could only be possible with partnerships. So we are lucky to have really good partnerships. I want to say starting with countries. You can't really work with the country unless the country wants it. And, so like Guyana and many other countries, we are working with them to advance their surveillance systems, their lab capacities, and, workforce development. So our countries, and then we have many regional stakeholders. Like you spoke for disaster, we work very closely with SEDIMA as the lead for disaster response. If something is happening like Hurricane Beryl or Melissa, SEDIMA is the first to be on the ground and CAFA is on the side with them in terms of the after effects of what happens on a hurricane. And then we have partners, international partners, such as the World Bank and IDB, as PAHO and Pandemic Fund and EU and others that really helps. So a lot of the digital surveillance that we have now has been possible through a Pandemic Fund grant. Excellent. We have a really good relationship with the Minister of Health. He is the current chair of the CAFA's executive board. So on Sunday we had an all-day meeting. Our executive board, looks at all the work plans and all the different aspects of our work in CAFA. He's also part of the Pandemic Fund board, and also he sits on the board for PAHO. So he's well known. He's a long-standing Minister of Health, and it's not a one-way relationship. He has a lot of vision and he works with us to see how we can, work not just, for Guyana, but really for the Caribbean in terms of improving and advancing health. Well, to me, I'm excited and I'm really bowled over by the type of advancement that has been happening with telemedicine here. And it really speaks to leadership and innovation. So, Guyana is a big country. Some of our islands can fit into your country. But you're geographically dispersed. So if you go up to Region 1 and all of that, it's really hard for healthcare. And you have communities, small communities or pockets of communities living in different areas. So access to healthcare is limited. And it's not always real time. So this advancement in telemedicine, this digital surveillance and being able to, to be able to apply public health surveillance from where you are here and being able to see how, for a community in another region is important. And if something happens, then you can be able to send a helicopter or plane so that they can come in and deal with it. So we find that very, 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 very innovative. And in fact, your minister is going to speak at our annual health research conference tomorrow about some of these innovations that really works for a region like this. We have Minister of Health Grenada and others that are learning from some of this, where you apply your health surveillance and health care to the type of context you have. It's really important. This conference is a first in many. It's the first time we have 12 international speakers, feature speakers, and we have speakers from Pandemic Fund and from the UKHSA, from Oxford and from Harvard and from universities. So you have all these international experts coming. But more importantly, we have 200 papers. So that means we have papers from all over the world and our Caribbean students or young researchers. And we really want to instill in them, and to guide them and to influence them to continue research. I mean, that's the whole idea of this research, to be able to persuade, to instill, to be an impetus to do more. So what do we expect? Knowledge gain. Then the other thing is that partnerships built, partnerships with the students to work with their researchers, partnerships between CAFA and the many agencies that are coming. CAFA is going to be having meetings with many of that. Partnerships built for Guyana, partnerships built for Guyana as well as the agencies. All that we are able to advance health better, more efficiently, faster, more effectively to promote lives and livelihoods for the region. But everything you have to put in context. And I'm glad that, Guyana is doing it in context. Things like, drone medicine. It may not be as easy, but I do think it can be done. To me, leadership is important, and when you're able to show results, and the fact is, with telemedicine, you're able to see that type of results. And there are other countries with similar geographical types of situations, like Belize. Belize is one of those countries that is big, and you have areas very, very far, and they have communities, cultural communities that you may have to meet. So depending on context, definitely I think it can be replicated, and CAFA stands in solidarity with Guyana, as we would stand with our other countries to really push and to promote what they're doing for the region as well.